Weird TikToks, let's go. Watch it wiggle, see it jiggle. It looks like Jell-O. Very well done. Okay, what this guy is showing you, this nurse injector, I presume, is that the hyaluron pen where he snapped it and the needle shot it in, you could see it all went into one big ball into one spot. Then when he put the needle in himself and he squirted in, he could pull back while he was laying in the filler and layer it properly. You want an experienced injector who knows the blood vessels and the other anatomy of the face. When they put the needle in, they slowly withdraw and they gently place the filler where it's supposed to go, because if it gets in the wrong layer, you can have major complications. If not, vascular occlusion, which can lead to tissue death, and you can literally lose your nose or lose part of your lip. Point well taken. The nursing staff and everyone is running around like chickens with their heads cut off, trying to get things ready for surgery while the surgeon's just kind of strolling into surgery. But hey, listen, we need to be calm before we cut human bodies open. She must be getting cool sculpting. All right, so she's getting cryolipolysis or cool sculpting, which freezes the fat cells and you then reabsorb them and urinate them off. Cool sculpting is not for weight loss. It's for trouble areas in some people. You can actually get the opposite effect called paroxysmal adiposal hyperplasia that had to be liposuction down, and then it didn't work. A couple points about cool sculpting. Number one, it is not a weight loss procedure. Number two, it's only for small trouble areas. Number three, people end up spending thousands and thousands of dollars on multiple sessions and it ends up not working for them the way they want, when you could have probably actually spent half the money and just gotten liposuction. Dude eats all his fruits and vegetables in one bite. Oh, yo, I've seen this guy. So these are synthol oil injections. These guys have body dysmorphia. He used to be a bodybuilder. They inject oils into their tissues. The dangers is you can get necrosis of the skin. You can lose limbs and get horrific infections. Do not do this. This is awful.
Pixie only has one goal in life, and that's to become a living cartoon. She's the first documented case in the world to have 6 of her ribs removed in order to shrink her waist down to 14 inches. Now, after that procedure, she actually changed the color of her eyes. This risky surgery isn't legal in the Western countries because it could essentially make you go blind. For a measly $6,000, Pixie managed to turn her eye color into cartoon green.
All right, you can find a surgeon anywhere in the world to do anything you want. The question is, what are their ethics? I would never do something like this to someone. Let's talk about some of the issues. So it's bad enough that some people take their 12th rib out to narrow their waist, but to take 6 ribs out, you're essentially taking out half of your chest wall protection where your lungs live, and if you just bump yourself, you could literally bruise your lung or cause an injury. And over time, I'm sure things are going to continue to shrink in, which I'm sure she'll love, and all those little organs inside are screaming because they need space.
I got botched in the US with the doctor. This is my lips 2 hours before lip injection.
Number one, I don't know what kind of filler she had. We only use, for the most part, hyaluronic acid fillers because we have an enzyme to dissolve them immediately if there's a problem. So I don't know if she had permanent fillers placed or if they put too much filler or if what happened to her is just normal swelling after being injected. Now, in some rare patients, they do have a reaction like this and they just need some steroids to calm it down, and then it all gets better. The last point is always make sure you go to a certified injector that knows what they're doing, that's using only good products and not putting stuff like silicone in your lips like we hear people doing in freaking hotel rooms. All right, here's what happened. This guy either had a rhinoplasty or a septoplasty, some kind of nasal surgery, and he had splints. The end of that video, they showed pulling out the splints, and what happens is those things just get caked with a bunch of mucus and snot. Now, the videos that he's showing you where he's pulling stuff out of his nose, most likely that was after he got his splints out. And then over the course of days, you can collect all this gunk inside your nose from having surgery. And he was just pulling it out with a Q-tip. And this is why we tell people to really use saline rinses in their noses after surgery like this to prevent all this stuff from building up.
Hey ladies, drop it down. Just wanna see you touch the ground. Don't be shy, girl, go bonanza. Shake your body like a belly dancer.
All right, y'all, this is extreme plastic surgery. Again, these are ethical things that you have to decide which side of the fence you sit on. For me, it's a no-go doing this. This person is famous. I've seen them all over social media. They have their lips injected, most likely with filler. But what's going on with those crazy cheeks? They make implants that go anywhere in the body, and what this patient probably had done are cheek implants where they make a small incision underneath the eyelid and they place a silicone implant just over the skull bone underneath the cheek, close up the incision, and that's it.
Did you know that rubbing your fingernails together like this daily stimulates the brain to send signals to adult stem cells to revive dormant and unproductive hair follicles? It also increases blood flow to the hair follicle for healthier hair growth. You think I'm crazy? Google it.
All right, guys, that's the end of a React video. If you like this video, drop some comments. If you have questions, ask me and I'll try to get to them. For now, guys, Dr. Ricky, out.